So yesterday I read a new article by Kajihara on interleukin-34. So interleukin-34 is a cytokine, an immune protein, and they were describing how this seemed to be a very important sort of linchpin of inhibiting the immune response. They were particularly looking at breast cancer, triple-negative breast cancer, but it seems to be involved in many cancers. And what they were describing was that this cytokine enhances certain immune cells, which we call basically monocytic polymorphic nuclear cells. These are some of the immune cells that are derived from the bone marrow, and they can protect cancer. And so this seems to be boosting those, and so inhibiting seems to really enhance the immune response. We've used other drugs, what's called a CSF1 inhibitor, which is along the similar lines. But the things that they described is that by inhibiting interleukin-34, there's a couple options. You can use monoclonal antibodies, or there's another drug that actually can inhibit interleukin-34 that seems to really boost the immune response, makes these cancers sensitive to immunotherapy, can make them more sensitive to chemotherapy. So really important point. I think that we'll see a lot more work. We're certainly going to be working in this area as well. So really interesting, finding more and more pieces. When you find these cancers that have immune resistance, and you can find, their Achilles heel, really helps a lot. Next week, the Society of Immunotherapy for Cancer, SITC. It's going to be in Boston. It's going to be it's always a super exciting meeting. Lots and lots of new topics. We'll see what's going to be the hot topic this year. I suspect it's going to be tertiary lymphoid structures, but we'll see. Certainly lots of interesting things. I look forward to meeting all my colleagues there, discussing different topics, finding out what are new treatment options for patients. We get more and more weapons. The more weapons we have, the more success we're going to get in patients. It's a matter of persistence, a matter of just keep attacking these tumors, hit more and more immunotherapy, more injections of tumors, and you can beat these. You just have to be persistent. So greatly look forward to that. I hope you guys stay tuned and see what we find out at SITC.